today we're going to cover one of the most common causes of vertigo or spinning sensation called BPPV. This stands for
B.
Benign. It's not dangerous even though it can feel really scary.
P.
Paroxysmal, which means it comes on suddenly, builds in pace and then slowly dies down within seconds to minutes. With the second
P.
That stands for positional changes, which means the condition is brought on by specific head and body positions. And the
V.
is for vertigo, the spinning sensation that you feel.
Do you remember the fluid-filled canals and the sugar rocks? In this condition, the sugar rocks, or otoconia, come loose and end up in one of the semicircular canals. Here, it's demonstrated by the glitter. When we change our head position, such as look up, the otoconia keep moving through that semicircular canal and they signal to the brain that we're spinning. If your symptoms last longer than a minute and aren't brought on by this head movement, it's unlikely that you have BPPV.
Now, to test for BPPV, we lay the patient on their back and record their eye movements. If the test is positive, we'll see some specific types of eye movements, and that depending on the way they move, it tells us which semicircular canal the otoconia have ended up in. This then allows us to perform the appropriate head and body movements to move the otoconia back out of that canal.
90% of the time, the otoconia will be in the posterior canal. And the test that we use for this is called the Hallpike, and the treatment is the Epley maneuver. Now, this condition is fixable, so if you aren't getting better with these exercises, it means your symptoms are being caused by something else, or those otoconia keep falling back out. In both of these cases, it's likely you're going to have to see a specialist to work out firstly what's going on, and then how to manage your symptoms appropriately.
But to summarise, BPPV is one of the most common causes of vertigo, but it's also the easiest to test and to treat.